Welcome to Ask Sid, the official podcast for Sydenham Clinic. Today I come to you from our flagship location here in Beverly Hills. I am so thrilled to bring different guests onto the podcast so that we can talk more about our 7 pillars of health, and we can go deeper into your genomics, your gut health, your hormones, your sleep, your nutrition, psychology and physiology. So let's bring it on. Welcome back. Today's topic is very interesting. We often seem to neglect our mouth. Your oral health and your overall longevity are related. Our gut is where we have the maximum diversity of bacteria. So the gut biome is actually related to your oral microbiome. And the oral microbiome is the second most populated area. So we have two specialists, the gut specialist, our in-house expert, the head of nutrition, Heather, and we have Dr. Charles Glaser from APA, Dr. APA's Diagnostics and Dental Clinic here in Beverly Hills. So we want a Beverly Hills perspective on oral health, prevention, and longevity. Thank you so much for joining our show.
Thank you for having me. It's a pleasure to be here. It's a pleasure to be with both you guys, and I look forward to chatting about our specialty at APA Aesthetic.
Yeah, so tell us a little bit about APA Aesthetics, because you guys have a very unique practice, and that's what was so exciting for us at Sydenham, that we wanted to partner with, a good dental practice that was a little progressive and really focused on prevention and longevity, which is what seems to be your approach.
So our mission at APA Aesthetic, it's very simple. It's function first, aesthetic second. And we're known as the leading cosmetic dental practice in the world, and we're all taught firsthand by Dr. Michael Apa, who's the leading cosmetic dentist nationwide and worldwide. So we practice from a functional approach where we're putting teeth into the correct place to prevent any sort of periodontal disease, any sort of gum disease, and to make our restorations predictable as well as beautiful. So that's kind of our mission at the company, and it's a blessing to be a part of such an amazing opportunity and team.
Yeah, that's great. Heather, tell us more about the mouth and the gut relationship, because there is a lot of research now that Alzheimer's, heart disease, erectile dysfunction, fertility, they can all be, you can go back to the gut or the mouth bacteria.
Right. I think the biggest thing that we're seeing is that there's this shift in non-communicable diseases because of the inflammation that's coming from a dysbiosis of this biome and stuff. So what's happening is they're creating more inflammatory responses because maybe the microbiome in the gut or the mouth isn't in equilibrium like it's supposed to. And that's creating this slow boil of inflammation that gives you more inflammatory markers all the way, downstream when you're looking at homocysteine or CRP and stuff. But when you look down at the root of it, you have to get into what's going on in the gut and the mouth.
Because they're not separate, right? One affects the other.
No, it's a continuous tube.
So what happens? Do we, when we swallow, we're swallowing bacteria or we're inhaling bacteria all the time.
Right. And chime in as you would like when you're taking food in and stuff in. I mean, there's things that in your immune system that are responding and killing things off and dealing with it, acidity, pH and stuff like that. The big one I see how the two are connected is when you're looking at when I'm looking at a GI diagnostic tool or something and I'm seeing H. pylori, which affects the stomach acid level, that acid is not there just to break down the food so that you can absorb the nutrients, but it's also to kill off some of the species in the mouth that we don't want in the gut because it disrupts that equilibrium.
So one reason for gum disease could be gut health. Are there any structural reasons for gum disease as well? Like the way your mouth is?
Improper oral hygiene. That's a huge one. Not coming to the dentist enough. Mm-hmm. Having plaque and calculus that is harboring below the gum line, and that attributes to inflamed gums, bone loss, and periodontitis. So yeah, those are all interrelated when it comes to having bacteria harbor in your mouth, and then when you're eating and when you're digesting, it's traveling down into your gut, and it's, contributing to other issues as well.
Yeah, like heart disease.
Absolutely.
Very common.
Endocarditis, diabetes. There's a handful of them.
So what's the weirdest thing you've diagnosed as just by looking at people's mouth, but it's actually another health issue?
Putting me on the spot like that, huh? I mean, we see a lot of interesting things. So, I mean, whether they have swelling in the floor of their mouth that was attributed to having plaque for a long period of time and it caused an infection, to their poor diet that has led to diabetes, endocarditis. Those are what we typically see. So, I mean, it's a huge component to having proper nutrition and, taking care of yourself. That's why we push patients to come to the clinic every.
So how do you manage them if you have these patients who have a poor lifestyle? Do you think it would help if they had a good lifestyle that was being managed by their doctor's office or by their nutrition? Because does it keep reoccurring, like their infections come back, or you're not getting good results because of their lifestyle?
I mean, a lot of it is what the patient sees value in. And if a patient is not willing to put themselves first and take care of the problem at hand, then no matter who we send them to, they're never going to follow suit with the necessary steps. So a lot of times what we do is we send the patient for a saliva test to see what pathogens are in their mouth. And then, there's times where we send them to a nutritionist and have them get back on the right regimen, and then they'll come for their frequent cleanings, and you just see such a reversal of, their overall status of life and their overall health of their oral cavity. And it's once they flip the trend, then, they start to feel a lot healthier and, live differently.
So Heather, tell me something, like sugar, like that's the biggest culprit, right?
Well, I was going to say,
Yes.
Yeah,
Yes.
You don't want to feed the bad bugs. That's what I say on repeat. That's not the form of food that is for the good commensal bacteria, and it's the same in your mouth as it is your gut. It's going to feed the bad bacteria and give them the source of energy as opposed to the other ones that we want living there.
So we also want good bacteria living in our mouth.
Right. Yes. So I have a question for you as far as using a lot of, either various stringent mouthwashes and stuff like that. I would imagine that kind of disrupts the flora. Do you see anything coming in from overuse of those things?
What we do notice, not particularly from mouthwash, but when people overuse fluoride, we do see that all the time. It's fluorosis, and they start to get white dots on their teeth. And we typically have, if patients are on a toothpaste that contains fluoride, we tell them to use it once a day and supplement that with your natural toothpaste as well. We typically like to tell patients to use Prevident, which has potassium nitrate, and it's really good for the tooth and remineralization of it. And that'll help kind of keep everything at bay and not, overexpose the tooth to more damage.
Yeah. Living them through.
Is there something that we should be eating to promote, good bacteria, and presuming that, they travel up and down?
Well, mainly it's like when I'm looking at how to, and I'm assuming, obviously, bacteria likes polyphenols, right? It's your plants. It's getting all of that nutrition from those plants, that all the different type of polyphenols. And I'm not talking about just one particular one. I know the species of the gut pretty well. I'm not as familiar with the oral cavity, but like, for instance, Akkermansia in your gut, it loves the red polyphenols. So red bell peppers, tomatoes, pomegranates, that's going to be one of its main sources that it likes to eat on. So similarly, I know you can ubiquitously say that that's what your microbes want, are the polyphenols, the fibers that are going to feed them, because that's what bacteria eats off of, the good ones.
So a lot of, like generationally, like our ancestors, they didn't need to go to dentists. They didn't have as many cavities as we have today. The structure was different because they lived on that carnivore diet. Do you see like a change from that perspective? Are you seeing like more crowding in the teeth? Like what has changed generationally?
I think our stress levels are a lot higher at the modern day. So that has led to a lot more of wear on the teeth, which is causing more cavities from just functional use and poor oral hygiene, intake of sugars. I mean, there's added sugars to everything now, and people are just digesting and going rapid fire with them. So we are seeing a lot of increase, decay in teeth, but that doesn't necessarily mean that, that's a bad thing per se, right? Like we're from a functional approach, we can treat everything all at once and kind of get to the point where we can reestablish oral health very, very quickly and educate the patient on what they should and shouldn't eat, how frequent they should come to the clinic, what they can do for prevention in the future. So I think it's all, I think that as long as the patient is educated on how to move forward, I think that it can all be maintained.
So what do you feel like ancestry has impacted should we be actually like using our mouth to like tear down, big pieces of steak, or like what's really good for for our teeth?
I know, I mean, looking nutritionally, we don't chew like we used to. Like we're not eating a lot of foods that require the chewing motion and stuff. And that's actually triggering metabolic hormones, just even the chewing and having the saliva and the mixture and stuff. So that's like digestion's beginning at that point. So I think mechanically, when I'm talking about the mouth and stuff and triggering one of the 30 metabolic hormones that start it, interestingly enough, a lot of times that I'm working on gut protocols and stuff like that, we're giving a lot of things having to do with like slippery elm root or marshmallow root or deglycerinated licorice. And I just think about our prehistoric ancestors that were just chewing on twigs, right?
Yeah, and that was a toothbrush.
Right, exactly. And they were making their gums recede by chewing on the twigs and stuff. So I think that's how they were kind of maintaining it and stuff. And that was also giving them so much of the insoluble fiber that was feeding and supporting, I think, gut microbiome, but obviously their oral biome as well and stuff. So.
Yeah, it's sad that like in today's day and age, like a dentist is working in a silo and a primary care functional medicine doctor is working in a silo when actually they should be working together, because your gut helps like promote healthy bacteria, and healthy bacteria in your mouth helps promote your gut health. So we're one body, we're one system.
Right.
What do you feel about that?
Yeah, I mean, everything starts in the mouth, and
For sure.
it migrates. So I think that if everybody takes a collaborative approach, I think that the overall health of humanity will be a lot stronger.
Yes. Well, thank you so much for that. And we have a tradition on our podcast where we dive into hot or not.
Okay.
So we have a list that's prepared by our marketing team. Thank you, Sarah. And just tell us what you feel about these different procedures, and if some of them are related to you, Heather, because he's our guest today.
Chime in.
Yes.
I'm going to defer to you.
So veneers in your 20s or ever?
Hot.
Hot. Okay.
Hot,
Composite bonding as a quick fix.
Not.
Turkey veneers and dental tourism?
Not.
Not hot? Okay. Mewing?
Not.
Okay. Thumb pulling devices?
Hot for kids.
Really?
Yes.
Tell us more.
We recommend orthodontia for young children, not for adults. A lot of times, a lot of times when we see adults going through orthodontics, they're tipping the teeth out, and it's causing us to prepare the teeth more when they're coming in for restorative work. So especially with kids where their palate is forming and where they're controlling the way that the bone is moving out and the way that the teeth are coming in, we do recommend orthodontics for children.
Great. Mouth taping, hot or not?
Hot.
Why?
A lot of people are doing it just for a more definitive jawline to restabilize their saliva in their mouth and for good overall breathing techniques. It's become a huge fad right now.
It doesn't impact like the structure of our teeth over time if they're mouth breathers?
It does. It causes your teeth to bow out because you're breathing with your mouth open, you're thrusting your tongue. So yeah, it definitely affects your dentition.
So what about night mouth guards versus master Botox?
I mean, traditionally we recommend night guards first before getting masseter Botox. In severe cases, there are times where we give them a night guard and it doesn't fix the issue. So we'll recommend them to start very lightly on the masseter Botox and see if that does work. But we normally defer just simply to night guards in the majority of the cases.
This one's for you, Heather. Oil pulling with coconut oil, or is it another oil?
Not.
Not? Okay, explain.
I'm curious about this one.
Well, I mean, okay, so getting into balance and everything, and it's just, to me, there's a lot of structure around what is good and what is bad in the world of healthy fats and healthy oils and stuff like that. And I think while coconut oil has some good things, it's not the absolute best and stuff. So, yeah.
Is there another oil we should be doing? Oil pulling genetically is not hard? Or
I don't know how to.
you'd say like
Yeah.
neutral?
Yeah. I'll say neutral on that one.
Great. So before we end our podcast, thank you so much. I think these are two aspects of health that, for us at Sydenham, the oral microbiome is extremely important. And that's why we regularly refer to the different dentists and be involved them very early, because it is a functional health. Your mouth is a part of your overall health system. Any tips you have for like overall health, which you like to give to your patients that are really like something that you truly believe in right now?
From the dental perspective, I mean, yes, get cleanings get cleanings every 3 to 4 months. If don't wait until you feel something to come see the dentist. A lot of patients, they don't think that it's a problem because it doesn't hurt. And more times than not, it ends up more work.
What about bleeding gums?
If you get cleanings often, your gums should not bleed.
Is there a personal health hack you have for your health?
I try to eat clean, go to the gym, meditate, to keep the headspace proper.
Is there a current trend that you would like to say, don't follow it?
Getting veneers in Turkey.
Don't go. Okay, well, thank you so much. Heather, any closing remarks from you?
No, it's been a pleasure to learn and understand more just about function and form and stuff. And yeah, have a lot more questions to ask you further.
Yeah.
Yes. Don't neglect your mouth.
Right.
Well, maybe later we'll get more into how kissing impacts your oral microbiome. Do we actually end up exchanging it?
Well, I will add to this. Whenever I'm treating someone with H. pylori and stuff, I tell them, change your toothbrush once a week because you can re-inoculate yourself, and do not share drinks. And don't drink.
And no kissing.
Well, that one's a little hard to ask them, but yeah, we talk about that a little bit.
Got it. Okay, so thank you so much for joining us, Sid. Please send us questions. We love to call in the experts. We're right here in Beverly Hills. We're also in Houston, Texas, which is the largest medical center in the world. Our in-house team is absolutely amazing. We're really redefining concierge medicine and elevating the game. Where can our followers find you? How do they contact you? Of course, you can contact Sydenham. We'll take you to him. We'll walk you to him. But how do they find you?
So The office is Appa Aesthetic. It's on the corner of Brighton Cannon, 9400 Brighton Way. We're a cosmetic dental office and we specialize in porcelain veneers. So if you're out there and you're looking to redesign your smile and or have any sort of aesthetic questions, we'll be happy to answer anything for you. I don't have the number off the top of my head, but you can follow me on Instagram, Dr. Glaser, Dr. Doc Glaser. So looking forward to meeting all you guys.
Yeah. We did a podcast with a plastic surgeon. He said smiling is great as a prevention for aging facial muscles.
Yeah, we snowed into that.
You can make us smile and make us smile look prettier, so we'd all work and coexist nicely.